An extensive family history of prostate cancer still didn't fully prepare Michael Justiz to hear the news from his doctor.
He goes, you have cancer. After researching a couple other hospitals that offered cancer treatments, I was looking not only at the treatment options, but the side effects. That's what led me to lean away from the surgical option and go into the possible radiation option, which, as it turned out, to be the best option for me.
Because we have all of the radiotherapy modalities, such as protons, linear accelerator, CyberKnife, MRI Linac, we can actually individualize the choice for every given patient. The radiation treatments can be delivered over a prolonged period of time, like 7.5 weeks. That would be the more conventional way of doing it. In many cases, we can do 5 sessions, which is called SBRT, stereotactic body radiotherapy.
Being an independent producer, I'm always on the go. 5 days makes it very doable. Another thing that I really loved about Miami Cancer Institute is they were the only ones in South Florida that had the MR Linac.
MRI Linac will actually visualize the prostate as the beam is being delivered. And if the prostate moves, the beam will be held until the prostate is back in position. In order to do that in the safest way, we actually use rectal spacer gel to push the rectum away from the prostate, minimize dose to the rectum, and essentially eliminate the risk of any severe rectal injury from the treatment.
Right now, I am 9 months past treatment and all clear. My PSA has dropped tremendously. This was a very positive experience. Outstanding. I really love the nurses there. You trust the facility, you trust the teams in the facility, and their level of professionalism is substantial. I was an excellent candidate for the 5-day regimen because I was diligent. And you have to be frickin' diligent. Don't be afraid to go to the urologist, get your checkup. You may just be early enough to get the easier treatment. The longer it goes along, the more difficult the treatment becomes and the less of your chances of survival become. So get it early. Get it early, because that could be the difference between life and death.